Hi everyone, I'm Anu Kathiresan, fertility physician and Dr. Mom, and here to educate on fertility. In this video, we'll be talking about early pregnancy symptoms and what symptoms can help tell you as soon as possible if you're pregnant. So let's talk about that today. Videos, I refer to the basics of the menstrual cycle before approaching a certain topic. So I'm going to do that for this video also. So I'm going to link a video for the menstrual cycle here for a more detailed explanation of that. But here I'm going to summarize what happens in the menstrual cycle. So at the beginning of the cycle, there's a follicle growing and a microscopic egg within that follicle that's maturing. That follicle is also making estrogen. Once the follicle reaches a certain size and a certain critical level of estrogen is reached, there are signals in the body that tell that follicle to release the egg in a process called ovulation. The egg will then travel down the fallopian tube. Hopefully intercourse happen around the same time. The egg and sperm meet in the fallopian tube. It then becomes an embryo. The embryo will then travel the rest of the distance down the fallopian tube and implant in the uterus. That follicle that previously released the egg becomes what's called a corpus luteum. And that corpus luteum will make estrogen and progesterone. If a pregnancy implants, then there will be HCG production, and that HCG will stimulate the continued survival of the corpus luteum and that continued estrogen and progesterone production. If a pregnancy does not implant, then the corpus luteum will regress and die off, the estrogen and progesterone levels will decline, and then a period will result. So it's important to have a general understanding of the menstrual cycle when approaching this topic because some early pregnancy symptoms can be associated with some of the dynamics of the menstrual cycle. For example, breast tenderness or breast heaviness and fatigue. These are often thought to be associated with early pregnancy, which could be the case, but they could also be associated with having an elevated progesterone, which is just a normal dynamic after ovulation. Additional symptoms also could be morning sickness that usually occurs about 1 month after pregnancy, and this can be due to the HCG that's being produced by the pregnancy. Other symptoms are, for example, implantation bleeding or some spotting, uterine cramping, bloating. These could be due to early pregnancy, but they could also be due to an impending period that may be coming. And again, it's hard to differentiate which it could be due to. Other symptoms could also be constipation, which is normal with pregnancy. There's some slowing of the gut motility, and that can result in constipation. Also food aversions, headaches, mood changes. But these, again, are not necessarily specific to an early pregnancy. Some women don't have any symptoms at all and are pregnant. So again, it's hard to know which symptoms could be more reassuring for pregnancy. And again, some women may not have any symptoms at all. One of the big red flags, though, is a missed period if a woman has regular cycles. So if a woman misses a period, it's important to take a urine pregnancy test. If it is positive, it's important to also call your healthcare provider. They'll most likely bring you in for a blood test, and then they'll also make sure the rise is appropriate. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.